Hey guys, Jen here with Serenity Hill Farmstead, and welcome back to our third episode of First Aid Fridays. Today we're going to be talking about bleeding emergencies, and I was a little hesitant at first to bring this up today because I don't have my tourniquet yet, and that is going to be an important part of what we're going to talk about today, but it still has not come. I have been waiting forever. I ended up having to cancel it. Bought it somewhere else. So when I get it, I'll do a little short video on how to properly use a tourniquet so that you can see firsthand how to use one. But for the purposes of today, I wanted to get the information out there because this is probably the most commonly run across emergency, especially as homesteaders, right? We're working with chainsaws, we're working with machinery, we get hurt. And if you are like our family, we get hurt a lot. So we have had a lot of injuries on our homestead from, we had a real close call with a chainsaw, which gave me a small heart attack. That was terrifying. Always wear chainsaw chaps. Thank God we had them. We had our son took a crowbar to the face, right between his eyes. We've had angle grinders all the way down to the bone. We've had all sorts of crazy accidents happen. And having a fully stocked first aid kit and the knowledge to use it is so important, especially since most of us are pretty rural and pretty far away from a hospital. So as a paramedic, the very first thing they teach us about is scene safety before you even get into assessing your patient and what's going on at scene safety. And like I said, we're talking about, homesteading. Not everybody that's going to be watching this video I know is going to be a homesteader. But in our situation, in our family, and for the vast majority of people that I think watch our videos, you're homesteaders or you're gardening or you're doing a lot of things on your own with your property. So you're not really super concerned about scene safety. And like I said, as a paramedic, this is the very first thing they drill into your head. And in fact, when we do our test, our practicum test, if you don't say scene safety, you will fail and you got to do it over. Or if you do it enough, they kick you out. But scene safety in a familiar situation, say you're in your backyard or you're out on your property or you're in your house, you don't really think about scene safety because you're in your own element. So let's use the example of somebody using a chainsaw and they're cutting kind of up, the improper way. And something swings down and hits them and they have this big open fracture, right? This compound fracture. Bone is up through the leg. You can see both the bones. You can see blood everywhere. Your immediate reaction, especially if you are not trained in any of this, is going to be the injury, the wound, the person, especially if it's a family member, somebody close to you. Your immediate concern is going to go to them. And you run over and you help them. But have you considered where the chainsaw is and if the rest of the tree is stable? So you need to consider that stuff because if you don't, you'll become another victim. You'll become a secondary problem for EMS when they arrive because they're going to go not to necessarily who was hurt first. They're going to go to who they can get to first and who is the most injured. So take half a second, make sure your scene around you is safe. Don't make yourself a victim and delay care for the other person. Not to mention, you don't do anybody any good if you're hurt or if you're dead. So now that we've gotten that out of the way, we've got scene safety, make sure your scene is safe, make sure everything is secure so that you can handle what needs to be handled. You can address the patient, the person that's injured. So let's keep with the example of the person that's injured from the tree using the chainsaw. So you see them hurt, oh my goodness, they're hurt. Eyes quick up, look to the tree is secure, the chainsaw's on the ground, it's off, you're good. The scene is safe. You go to the patient, you go to the person. I'm going to say patient repeatedly. It's just where my brain goes. Naturally, where your brain is going to go, where your eyes are going to go first, is going to be to the wound. But that's not necessarily what needs to be taken care of first. So the next thing you need to be considering, just keep it in the front of your brain. Say it over and over and over. Train yourself that this is what needs to be handled, is your ABCs. Your airway, your breathing, your circulation. 9 times out of 10, in a situation like that, you can jump straight to circulation. They're going to be screaming. You know that they're breathing. They're alert. They're awake. It's the leg that is the problem. However, what if that tree came and knocked them out and you see the wound, but you don't see that their head is, kind of all frumped forward and it's occluding their airway. It's blocking their airway. In a choking situation, the most common occlusion to the airway is the tongue. So you want to just make sure that, they have a clear airway, even if they're knocked out, that they're breathing, because that's your most important thing. And then you move to circulation. And in this situation, it's the leg. In a medical situation, it would be, do they have a pulse? But in this situation, it's going to be the leg. So here we have this big open wound, right? What kind of bleeding do we need to assess? That's the first thing that we need to figure out. Is this arterial bleeding or is it venous bleeding? Is it coming from an artery or is it coming from a vein? And it's pretty simple to tell in most situations which kind of bleeding you have. Arterial bleeding is going to be bright red and it's going to be coming out a lot faster. And most of the time it comes out, it shoots out with each pump of the heart. With a venous injury, with the vein being cut, that is a deeper red. It's almost, everybody's blood looks a little bit different, but it's almost kind of like a brick red. If you've cut your finger, you've seen venous blood. You know what everybody knows what venous blood looks like. That kind of can more typically kind of ooze out. It is much slower going, and it's not typically a life or death situation, which in an arterial bleed, that is a life or death situation a lot of the time. Regardless of what type of bleeding this is, you need to stop it. So how do you stop it? The obvious thing to do in the situation is apply pressure. With a vein, the veins, when they get cut, they stay put unless there's some really traumatic injury and things are really mangled up, which in our situation with a compound fracture could be the case. And you really can't put direct pressure on a compound injury, a compound fracture. If you have something protruding out, you can't exactly put direct pressure on a bone. You could cut yourself from the shards of bone. You could cause way more damage, not to mention how painful that would be for the patient. But in a pretty clear cut, just kind of a wound, a laceration, a deep cut, something like that. Say there was no fracture, there was nothing penetrating into the skin, then you could apply direct pressure to a venous bleed. Now, with an arterial bleed, the thing you have to consider is the way arteries behave. Arteries they're encased with a type of muscle that makes them behave like a stretched out rubber band. And what happens when you have a stretched rubber band and you let it go or you cut it? It snaps back. So you're going to have that situation. You can have that situation. A lot of the time you do have that situation in a severe trauma, in a severe injury like that, where the artery is getting cut. If it's going to be that deep, it's probably going to happen. That artery is going to snap back. And you're going to need to control the bleeding, not where the injury is, but above where the injury is. And usually it's just maybe a couple inches, but it could be higher. So if you have a situation where you're putting pressure above the injury, above meaning closer to the heart. If you're applying pressure closer to the heart, if you're applying pressure above and you're really putting pressure on there and it's not slowing down, you might need to go up a little higher. There is another technique that you can use, and that is applying pressure directly to the pressure points, the arterial pressure points. And these are the pressure points like in the femoral arteries, the brachial arteries. I think there's 4, if memory serves. I need to refresh on that. So let's use the brachial arterial pressure point as an example here. Your brachial artery is up underneath here. And when you push on that, go ahead and try it on yourself, right about here. You feel it shoot down your arm. So what is right there with your artery? You're close to the bone, you've got the nerve bundles, you've got all sorts of very sensitive things in there. If you push on that, that is going to occlude your brachial artery. So in a situation where, say, you've got a big open wound here and you can't get control, it's an arterial bleed, blood squirting. You cannot control the bleeding there. You can't control the bleeding here. You can come up here and push down on that brachial artery, and that will significantly help you. In a situation where you cannot control the bleeding, or say you've got control of the bleeding, but you can't just sit here and hold it, you need to call 911. You need to do other things to help this person. So you have to do some kind of dressing, and you have 2 options. You can do a pressure dressing or a tourniquet. How you decide which one of these dressings you're going to do really just comes down to time. A tourniquet is going to be something that is going to cut off all blood flow, all circulation to the extremity, to what we call distal, which means away from the injury site. So if you have the injury here, we were talking about a leg, but now we're talking about an arm because it's awkward to pick my leg up here so y'all can see it. Okay, so we're talking now to the arm here. If we have an injury here, right here, okay, and you can't get control of this, or maybe you do have control of it, but you can't let go where it starts bleeding really heavily again, you got to put a dressing on. So if you put the pressure dressing on here, then you're still going to have a pulse. If I check my pulse, I should still have a pulse. It's not going to be turning colors. I'm still going to be able to feel and move my hand. If you put on a tourniquet, which would be above the injury, that is going to cut off all blood flow. It's going to cut off all circulation. It's going to get cold. it's gonna start dying. And within a couple hours, that limb will need to be amputated. Now, me personally, and the way I was taught is you start with pressure dressing. You don't go straight to tourniquet unless you know it is a super, super severe injury and there's no way that's a pressure dressing is gonna cut it, and you have to do a tourniquet. And really that just comes down to experience. And certain injuries, when you see them, you know what it's gonna require. And in something super severe like a partial amputation or something like that, you need to jump straight to tourniquet. But if it's something where you think you can get good control of the bleeding, or if it's a big laceration, but you've got a good area where you can put pressure on and you can get control of the bleeding, then you want to opt for a pressure dressing. So there's a number of things you can use the pressure dressing for. You can use a lot of things for a pressure dressing. They do make things that's just kind of a one and done kind of a thing where you open it up, you put it on there, you wrap it around, you tighten it, and you're good. And it's fast. And those things are really good if you spend the money and get the high quality things. And those are single use, you don't use them again. Same thing with a tourniquet. Don't waste, don't buy cheap here. This is a life-saving apparatus. You don't spend $100 on a tourniquet, but you don't want to spend 10 either. You need to find a good quality tourniquet. And when mine comes, I will share it and I will give you a link and all of that. It's coming. But if you want something now, just do your research and find something good quality. The one site that I know is very popular in the prepper community is Refuge Medical. They do have super high quality stuff, but it is also super pricey. Worth every penny in my opinion. But if that is not in your budget, there are other options. And like I said, I will share with you what I have purchased coming when it comes. But back to the pressure dressing. So once you've got the pressure dressing on, you need to do what's called Csm checks. You're going to check for circulation, you're going to check for sensation, and you're going to check for movements. So here's my pressure dressing. Is it still got a good color, a good pallor? Is it still pink? Is it turning cold, or is it still, warmer? Now, if you've lost blood, you're going to be cold. You're going to be white or maybe a little ashy. That's normal. That's normal for a blood loss. But you don't want it to be getting worse. You don't want it to start turning blue, start turning purple. Look at the nail beds. Another thing that you should always keep in your first aid kit is nail polish remover, or nail polish remover pads, even better, because if someone has nail polish on, you can't see the color of their nail beds, which is important in many, 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 many emergencies. But watch for color, feel the temperature, and then check for pulse. And how you check for a pulse, if you do not know how to check for a pulse, find the bone, the wrist bone here, 2 fingers, and just go in. Just turn in about an inch. That's it. And don't push hard, because if you push hard, you won't feel it. It's just gentle and you'll be able to feel it. Also, if you're going to take a pulse, don't use your thumb, because you'll feel your pulse. So things you can use to make a pressure dressing. Gauze. You got to have gauze. Lots of gauze of all different shapes and sizes. You need to have a lot of gauze. And then you can use Curlix, which is the large, it's probably about that long and about that big around, and it's a little stretchy, so that helps too. I've used that many times in the field as a pressure dressing. And also you can use Ace wraps. Ace wraps are really good. Again, make sure you get good quality ones. And the type, forget what they're called. They do have a specific name. But the types of Ace wraps that stick to themselves are also a good option. But those are harder to kind of refigure and manipulate. Once you put them on, if you have to tighten or loosen, they're harder to work with. So that's not my first choice, personal choice. Like I said, when I do my tourniquet kind of example video, it'll just be a short little video just to show you, just to kind of give you the visual. But when you do a tourniquet, when you apply a tourniquet, you're going to apply it above the wound, not in a joint, above it. You're going to apply it above the wound. It's going to be tight. It's going to hurt. It's not going to be comfortable. It's not meant to. It's meant to save a life, not to make somebody comfortable. But what you need to do, you have to make sure you do this, write the time. Now, in a lot of tourniquets, they have this little thing that you can just kind of like pull off, or this just little thing that you can take a Sharpie and write the time on it so that the hospital can see that. However, we're talking about a severe injury here, and blood gets into everything. So there's a good possibility that will cover it up. So what we are trained to do is write everything on the patient's forehead. It'd be nice if you didn't use Sharpie, but use what you have. And that does a number of things for the emergency room quick. It tells them that somebody has applied a tourniquet. It tells them what time the tourniquet was put on. It tells them how much time they have left to get to that person to save their limb. Remember I said when you apply a tourniquet, you only have a couple hours until that limb is dead and has to be amputated. So time is of the essence. If you are going to use a tourniquet, you have to make sure you get to the hospital as fast as you can if you have any hope of saving that limb. So that's your two options. You can do the pressure dressing or you can do the tourniquet. I know it's a lot to consider because in the situation you say, oh my gosh, I don't want to be the person that is responsible for this person losing their leg or losing their arm. That's so devastating. This is life or death, and you have to remove yourself from that situation in that moment. Could they be angry at you if you put a tourniquet on and cause them to lose their arm or their leg? Yes, they could. Are they still alive to be angry at you? Yes, they are. So you do what saves the life and worry about the rest later. So I want to make a quick mention about techniques. Now, in a field situation, let's go back to the tree, shall we? In that kind of situation, there's mud, there's sawdust, there's dirt. It is not a clean, sterile field environment. It's dirty, it's messy, it's nasty, right? Do what you can to be mindful about keeping things clean. It is very difficult. If you have not done this multiple times, if you don't have the training to do that, it's difficult. And even if you do have the training, sometimes it can be such a mess and such a disaster that it's still really hard to do. But infection is a very real thing. Infection can kill people later. It's not the primary concern here. The primary concern is stopping the bleeding, saving the life. But just be mindful of it. If you drop your gauze in the mud, don't pick it up and put it on the wound. Simple kind of common sense stuff like that. So that is what I have for you today on bleeding. Now, there are a lot more things that I could talk about, but I don't want to kind of overwhelm, and I don't want to get into things that would be too complex for someone that is new just coming into this. So I feel like that is a good amount of information for you to have good life-saving skills, things to practice, things to consider. Make sure you go over this information. Do kind of mock drills with it because nobody gets good at this and nobody's skills are reliable unless you put them to practice. I hope you found this video helpful and that it can serve you well in an emergency. Again, I'm going to say it a million times, guys. It's going to drive you nuts. Practice, 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 practice. Practice with yourself. Practice with your spouse. Practice with your children. Your children should know how to do these things too. It is very, very possible to teach your children without traumatizing them about possible situations. Make sure your children are prepared too. So if you did like this video, don't forget to hit the thumbs up button, and you can share this video as much as you like. In fact, I would greatly appreciate it. Interacting as much as you can with the videos tells YouTube that you like these videos and you want to see more of them. And it is very important to me personally to get this information out to as many people as possible. There's a lot of first aid information out there, and I've come across a lot of wrong information, and so a lot of information that just has a lot of holes in there. Remember, as great as it is to get good, reliable information from somebody that has done this job for a living, it is more important to be able to put your hands on these things and do them in person. So if you have the ability, make sure you take a first aid class and you get good hands-on training from someone that is experienced. Don't forget, guys, make sure you hit the subscribe button and the notification bell so you can get notified the next time we put out a video and the next First Aid Friday, and we'll see you guys soon. Bye.